So hi friends, good evening again. So a lot of our patients have asked me to talk about what are the points or what are the steps they got to do post rhinoplasty so that their recovery is uneventful and smooth, right? So I'm going to put this up in a nutshell. So let's say you've gotten your rhinoplasty done, and on day 7 or day 10 or day 12 is a time when you leave the hospital. This is what typically happens here at Richardsons. Now in another hospital it might be slightly different, but I'm trying to tell you especially what's going to happen here because a lot of your issues tend to happen within the first week to 10 days. And we in the first place request, and in fact even sometimes coerce you to stay with us, either the hospital or nearby, so that the main healing is taken care of by us under direct supervision. Do remember this, very, very important. It's fanciful or okay to say, okay, rhinoplasty done, you go home the same day. Yes, but that doesn't work well so much, especially not for the patient. Also because we're doing major nose surgeries that involve bony work. And you have to understand the very basic healing for bones is 4 weeks. So when we are altering the shape of the nasal architecture, especially the bone, the septum, so we would expect you to stay for at least 10 to 12 days. That's what I'm telling more and more of our patients. And that is primarily because most issues tend to happen in that period. And then if it does happen, we are here to troubleshoot it, to fix it, to solve it. All right. Having said that, what other things you must be careful after you leave Richardson's after rhinoplasty, for example? Number one, most important thing, please make sure you don't bump your nose. Even the slightest of trauma can sometimes make a small difference in the position of your tip. So be very careful. Do not get your nose bumped anywhere. So if you have kids, don't make them sit on your lap, for example. Don't go to crowded areas, dirty, crowded areas, so that you get a chance of infection. So we need to reduce that. The third reason is you have to make sure that there is normal healing happening. So for example, you wouldn't want to go for major exercises like gymming or swimming. I think it's best avoided for 4 to 6 weeks. However, minor walking or minimal exercise is all right. No aerobics too. So these are the things that you would want to avoid. Now, what are the things you don't have to avoid? Diet is not a problem. So you can, have normal diet, good, healthy, nutritious diet, so that the body is recovering from a surgery, and so that will help you to recover faster. Now, with regards to scarring, and the Indian sun is pretty harsh, so I tell patients, if possible, not to go in direct sunlight, especially if you have done some ALA work and osteotomies, because in a few patients, I find those areas to become hypertrophic, or they look a little darker than the surrounding skin. So if you can avoid, that's nicer. The other thing that will help you is to make sure that during the healing period, you do not wear a mouth mask, especially in the first few weeks, because some of the masks with the elastics can apply pressure on the dorsum and you can have a small depression there. To avoid that, we also give some silicone formers which you can use, like Rhino Shield. That works in some patients if you have to wear a specs, or you can wear contacts, or you can use them as minimal as possible. I think these are the things that you can do. Now, over and above all this, I already mentioned to you about the exercise part, a very important aspect. So you have to delay the exercising because that can cause delay in your healing. So these are pretty much the main things. So be careful. You can take bath. This is something also many patients keep asking. You can definitely take bath. Make sure you dry it carefully. Avoid facials, lasers, other facial massages and everything for 4 weeks minimum. I would recommend use of lasers to be delayed to up to 2 months if possible as well. So we also give our contacts, our follow-up numbers to all the patients who get their rhinoplasties done here. So you can definitely get in touch with us if you have any more doubts and queries. But these are the main things. We do not give most of our patients antibiotic cover that late when you leave. But for some patients, we do give some tablets that reduce swelling. We do give scar creams that are required in some patients, especially when the ALR based work is more. So whenever these things are given, you have to use them and avoid all the things I've told you. And I think you should have an uneventful, smooth healing post nose job or rhinoplasty. Thank you.